Tracking the vaccine for you tonight. While current vaccine shortages are affecting just about every medical outfit who gives the vaccine, some rural doctors say they often have an extra layer of obstacles to tackle when trying to secure doses for patients. It's something they say can result in more last-minute rescheduling and sudden increases or decreases in vaccine supply.
Fox Carolina's Matt Koufax talked with doctors from rural areas in both North and South Carolina and is live tonight. So, Matt, what did you learn today?
Yeah, well, Cody, Tori, doctors who I spoke to say that one factor to consider is the fact, and I spoke with doctors in both Abbeville and Henderson counties, they say that while they've primarily vaccinated folks in their base counties, policies in rural areas have been a little different, just to vaccinate all those who qualify regardless of where they come from in recent weeks and months. But now they say they don't really even know what next week is going to look like. Dr. Trey Moore with Abbeville Medical Center says he believes rural areas don't always get as much of their fair share of the vaccine as they need.
My opinion of that is that that's a disservice to the individuals that live in rural South Carolina.
He says their system in particular of acquiring vaccine is unique and not always in a good way.
Unlike larger hospital systems, we are not receiving direct shipments from Pfizer, but rather are receiving them through redistribution.
He adds that for this, DHEC handles the redistribution.
The downfall of that method is that once we receive our vaccines, we must use them within 5 days. So it's created situations where we've been forced to give out 1,800 vaccines in a week.
He says other times it's been as low as 150.
We actually went a couple of weeks where we didn't get any.
Dr. David Ellis with Party UNC Health in Henderson County says their supply has also been widely fluctuating lately.
And I think there's frustration on everybody's part. Certainly the patients in Henderson County are frustrated.
He and Moore say waiting on pins and needles eliminates flexibility in administration.
To say that it's a constant that we can plan ahead, if you ask me what I'm doing 2 weeks down the road from a vaccine standpoint, I have no idea.
But perhaps the most frustrating aspect of all is the lack of a real solution. Is there anything we can do other than sit and wait?
No, I don't think there is, Matt. The amount of vaccine that's available is limited.
Ellis tells me that in North Carolina, on their side, they are waiting to see if the state will change its allocation. It was scaled back in recent weeks by the Department of Health and Human Services because of the supply shortage they're having. Meanwhile, Moore tells me that they normally find out from DHEC on Thursdays what their allotment for the next week is going to be. But because of the shortage in South Carolina, also happening over here, he says that they're having to wait till at least tomorrow, possibly longer, to figure that out now. Both of them say they just hope they don't have to keep adding names to waiting lists. In Greenville, Matt Koufax, Fox Carolina, the 10 o'clock news.